So who's ready to learn about pharyngeal arches? So also known as the brachial arch derivative. So the pharyngeal arches. This is going to be a pretty difficult lecture simply because I'm not really able to draw it out. I am able to list off the major buzzwords, the major associations. However, this one is going to be more of a conceptual lecture. I'm going to teach you the basics, then we're going to go through arches 1 through 6, excluding number 5 because that doesn't really have any significance. So let's talk about the basics of the pharyngeal arches. Like I said, there's going to be 6. Let's talk 5 is unimportant because there's no adult derivatives. It does develop embryologically, however, in the adult, there's no adult derivatives. Alright, so that's an important note. So we've already knocked off one of the 6. That's all I'm going to talk about, number 5. Number 1 can be also called the Mandibular Arch. Number 2 can be called the Hyoid Arch. Hyoid Arch. Alright, so we've knocked off a couple of the basics. I will refer to number 1 interchangeably as just pharyngeal arch 1, or the first brachial arch derivative. And brachial arch spelled like that. These terms are interchangeable. So let's go over some of the basics. They develop in the 4th week of life. So during the 4th week of uterine development, the pharyngeal arches will come into existence. So also what happens in the 4th week of life, you're starting to see fetal heart development, and you're also starting to see limb development, both upper and lower limb development. And then we'll also see the pharyngeal arches. So the 4th week is pretty important. You have the heart rate, you have your limb development, but then you also have these arches that are starting to develop. And what are these arches that I keep talking about? Well, they're going to be mesoderm. And what they are is they're going to be mesodermal outpouches of the developing fetus. So near the mouth, so you have the stomadeum. So near the stomadeum, which is going to be like the fetal mouth pretty much, you're going to see these 6 arches, and they're little mesodermal outpouches that start to develop. They're eventually going to develop into craniocervical structures, so the structures of the head and neck. So the craniocervical structures derived from mesoderm, and they're going to be located near the fetal mouth, so the stomadeum. Okay, so let's change colors and move on. So we've got the first arch, also known as the mandibular arch. I'm going to break this down into categorizing it into 4 different categories. We're going to have muscles. We're going to have cartilage. We're going to have nerves. And then lastly, we'll have arteries. Arteries. Okay, so this is how it's going to go down. Each arch gives rise to a different set of muscles, different set of cartilage, different set of nerves and arteries. This cartilage is going to eventually turn into bone. However, during embryogenesis, it's just going to remain as cartilage. And then it'll eventually calcify. So let's go over some of the muscular components. When you're thinking the first pharyngeal arch, the big muscle to take away from this is mastication. Mastication. Probably a top 3 most important thing on this slide. So let's start off with it. The muscles of mastication, there's going to be 4 muscles that are going to be used for chewing. You're going to be using the temporalis muscle. You're going to be using the masseter muscle, and the lateral and the medial pterygoid muscles. There's a silent P, the pterygoid muscles. It's pretty important to remember those because I've had quite a few test questions in my life that have dealt with that. The first arch is going to deal with the muscles of mastication. And then I'll show you what the second one is, and it's good to keep the difference there. So also we've got the mylohyoid. You've also got tensor veli palatini. There we go. You've got the tensor tympani muscle. You've got the tensor tympani muscle. You've also got the anterior belly of the digastric. So digastric. And then let's see. You've also got no, we'll leave it at that. You've got the mylohyoid. I already covered that. And then you've got the muscles of mastication. That'll be good. So you've got cartilage derivatives as well. The cartilage derivatives are going to be the maxilla, the mandible. We've got the incus and the malleus. So a lot of M's. Look at all these M's. We've got mylohyoid, mastication. So when you're thinking the first pharyngeal arch, the mandibular arch. So one is also known as the mandibular arch. So we'll go back. Mandibular arch. Think of M's. We've got the maxilla, the mandible, the malleus. The incus and the malleus are going to be inner ear bones. You have the three. The stapes will be from the second arch. And we'll cover that pretty soon. However, the incus and the malleus come from the first arch. Then also we've got Meckel's cartilage. Alright, so that's about it for the cartilage derivatives of the first pharyngeal arch. So what you should be kind of realizing is we're starting higher up. The first pharyngeal arch starts in the head, because remember the pharyngeal arches, the 6 of them, develop into head and neck structures, and that first one is going to start up higher, and it's going to start up in the head. We're going to cover a lot of head stuff. Okay, so that was a little kind of side. Some of the nerve derivatives. We have V2 and V3. So the V simply stands for the 5th cranial nerve, so cranial nerve 5, so the Roman numeral 5, and then sub 2. So the 5th cranial nerve has 3 subcomponents. It has cranial nerve part 1, or cranial nerve 5, part 1, part 2, and part 3. The second part and the third part are going to innervate kind of the maxilla region and also the mandibular region, so the mandibular branch. So you're going to get the cranial nerve 5, part 2, and part 3 of the trigeminal. For arteries, you're going to get the maxillary. The maxillary. Alright, so if you've noticed anything, we've got a lot of M's, and that just adds to the M's. Also, we're going to include the external carotid. Okay, so that's it for the first pharyngeal arch. Let's pick this up with number 2, and this is going to be the hyoid arch. So again, we've got muscles, we've got cartilage, we've got nerves, and we've got arteries. So what are we going to deal with here? Well, for the muscles, pharyngeal arch 1 is going to start high up in the head. Next to the second pharyngeal arch, we're just going to sequentially move down a little bit, kind of near the head-neck region, the junction. So what are we going to see? Well, we're going to see the muscles of facial movement, so the facial expression. Anything that cranial nerve 7 innervates for facial movements is going to be there. So there are 20-something muscles of facial movement. I'm just going to write facial movement. Okay, so any muscle that that you use to smile, to puff out your cheeks, to frown, any of that is going to be derived from the second pharyngeal arch, your hyoid arch. Okay, so we've got the platysma as well. That's going to be the stuff in your neck, the really superficial thin layer. You've got this Stapedius. The Stapedius, and so we've got a Stapedius muscle which means we're going to have the stapes bone. The stapes is an inner ear bone. Your stapedius muscle is touching that stapes bone. It's going to be used to modify your sound. The stapes, we've also got the posterior belly of Digastric. I said that we already covered the anterior belly, so this is the posterior belly. Then we've got the buccinator. The buccinator muscle. So what is important about this? It kind of should be involved in mastication. It is not one of the four muscles of mastication, because remember, those were the temporalis, masseter, and anterior and lateral and medial pterygoid muscles. The buccinator is going to be used to keep your cheeks taut against your teeth. And what that's going to do is it's going to allow you to chew food effectively. And so an easy way to remember this is when you play the bugle, you need to use your buccinator muscle to kind of bring your cheeks in taut when you kind of blow a bugle or blow a trumpet. So it's the same function. You bring your cheeks in taut, and that's the function of the buccinator, the bugle. Okay, lastly, we've got the stylohyoid, just for completeness sake. All right, stapes. So that's one of them. We've got Reichert's. There we go. Reicherts cartilage. Reichert's cartilage. Styloid process. Hopefully you should be making a connection there. The stylohyoid, the styloid process. Then we've also got the hyoid. Okay. Nerves. Easy one. All the facial muscles. Every facial muscle that is going to be used to control the face. So we're thinking facial nerve. Cranial nerve 7. So a facial nerve will be derived from the hyoid arch. Also, we've got the hyoid artery. Pretty easy. See a trend here. Hyoid, hyoid, hyoid. Lots of hyoids. We've got the stapedial artery. So the stapedial artery. We've got the stapes, the styloid process. The stapedius, there it is. Sorry, I was looking for it. Okay, that's it for the second cranial arch. Those are the two big ones. So we just got all the hard ones out of the way. From here on out, it's going to be easy. So we have a third derivative of the pharyngeal arch. This is going to be responsible for, let's see, artery. I don't know what that line's doing in there. It's going to be responsible for the stylopharyngeus. The stylopharyngeus. That's it. One muscle is primarily going to come from the third pharyngeal arch. So what cartilage will be derived? Well, we're going to have part of hyoid bone. Remember, the hyoid bone is going to be kind of a free-floating bone, not connected to the rest of your skeleton. You're also going to have a couple other structures, such as the thymus. I already spelled it. Thymus. So I have a thymus kind of development video, so how T cells develop. Your thymus is going to be involved in that. And I already alluded to that it was thymus was a derivative of your third pharyngeal arch. You're also going to have your inferior parathyroids. You have 4 parathyroid glands, 2 superior and 2 inferior. Your inferiors are going to come from your third, while your superiors will be coming from your fourth. It kind of seems backwards because you're kind of working top to bottom. This is one of those instances where it doesn't fit. What nerve is cranial nerve 3? Well, it's going to be cranial nerve 9. Cranial nerve 9, your glossopharyngeal nerve. And then also we've got an artery supply. It's going to be your common carotid. And it's also going to be your internal. So your external carotid was your first branch. Your internal carotid is going to be your third branch. Now let's talk about the fourth one. Not as easy as the third, however not too conceptually difficult. Nerve, artery. So we've got the cricothyroid muscle. The cricothyroid muscle. We've also got the soft palate muscles that allow you to raise your soft palate. Also got the levator veli palatini. Veli. I don't know if that's spelled right. The levator veli palatini, but I know that is a muscle of the fourth. Spelling is not my strong point. Also, we've got some thyroid cartilage that's going to be developed. So the thyroid cartilage. We've got superior parathyroids. I already said that. Your superior parathyroids. And then also we've got the epiglottal cartilage. So your epiglottis. Okay, and then we've got nerves. What nerve? Well, I'm just going to go back here so we can see the progression. We had cranial nerve 5. Then we went to 7. Then we went to 9. Now we're going to go to 10. It's all sequential. Cranial nerve 10 is going to be your vagus. Your 10th cranial nerve. Also, we're going to see the superior laryngeal nerve. Then you've got the artery. It's going to be your subclavian. Subclavian, artery, and then your aortic arch. Okay, so we've got the subclavian, the aortic arch. 5, our 5th. Just kidding. We don't have adult derivatives. Nice. Moving on. So now let's talk about our last and final pharyngeal arch. So we've got, again, our muscle, cartilage, nerve, artery. For the muscles, it's going to be your larynx muscles, the muscles of your larynx. They're pretty much going to be innervated by your 5th pharyngeal arch nerve, which is going to be that superior laryngeal nerve. However, your larynx muscles develop from your 6th arch, except for the cricothyroid. So I'm going to do except for the cricothyroid. Okay, so that's an important concept. The cricothyroid was from the 4th pharyngeal arch. Just remember, see if I can go back. Here's our cricothyroid. That'll be a muscle of your larynx. So pretty much all laryngeal stuff will come from 6. All the muscles will come from 6 except for your cricothyroid muscle. Cricoid cartilage. That's it. Cricothyroid cartilage from the 6th pharyngeal arch. What are we going to see? Nerves. We're also going to see cranial nerve 10, your vagus. And then also you've got the recurrent. And lastly, we've got artery supply. It's going to be your pulmonary artery, going your pulmonary, so your lung artery, and then also your ductus arteriosus. Just as a little side note, you can have a patent ductus arteriosus, and you'll see that in newborns, some newborns. I'll leave it at that. So your ductus arteriosus. We do have a disorder. Oops. We do have a disorder. So here's our last one. We'll end on this. We're going to deal with Treacher-Collins syndrome. So Treacher-Collins syndrome. So what is Treacher-Collins syndrome? Well, it's also known as mandibulofacial oops, I don't think I spelled that right. Dysatosis. I don't know if that's spelled right. but it looks right. So mandibulofacial dysostosis. What it is it's going to be an autosomal disorder, autosomal dominant disorder. And what we're missing is we have the TCOF1 gene. And that's going to be responsible for your neural crest cells of your first and your second pharyngeal arch. So neural crest cells of your first and your second pharyngeal arch. So remember, the first one was your mandibular, second was your hyoid. The first and the second one had the whole long list of stuff. It had your muscles of mastication, facial expression, a lot of bones of your face and of your head, and a little bit of your neck and your head-neck junction, but really it was dealing with your head development. So you've got the first and the second pharyngeal arch. So what would we expect to see with this autosomal dominant gene mutation? Well, if we have first and second pharyngeal arch problems, we're going to see hypoplasia. So what this means is you're going to have like cheekbones that are absent or missing, or hypoplasia, or smaller, less developed. You're going to see mandibular hypoplasia as well, or possibly mandibular bone that is not developed. So mandibular problems. You may also see ear problems, because remember, the stapes, the incus, the malleus were all derived from the first and the second. So you may have conductive hearing loss. That's an important one. Really anything else that can be derived from the first or the second arch. So when you think of Treacher-Collins syndrome, think it's an autosomal dominant disease where the first and the second pharyngeal arch do not develop normally due to those neural crest cells that can't migrate properly. Embryogenesis is such an intricate process, and if anything goes wrong, all the adult derivatives of these first two arches will have some sort of defect. Maybe this gene causes the first pharyngeal arch to develop normally, but leaves out parts of the second pharyngeal arch, so you're going to have facial expression problems, or the vice versa, where you'll have first problems, but second functions normally. It's kind of a overall encompassing disease. It's a syndrome that can present differently, because during embryogenesis it depends on what features develop properly, and then that'll manifest into the adult presentation. You may see the ear problems, you may see hypoplasia of face muscles, of facial bones, of the mandible. It just depends. So hopefully I've covered everything you need to know about the pharyngeal arches. Sorry I didn't have any pictures, any animations, any drawings. This was kind of a tougher concept to put together, simply because you can't actually visualize it. You can say what the pharyngeal arches go into, because if someone was missing a pharyngeal arch, you can see the manifestation of what that is in the adult. So if they're missing cranial arch 3, they're going to have an absent stylopharyngeus muscle, for example. It's very kind of sequential. If they're missing part of the third arch, then you'll see what its derivatives are missing in the adult. So if you have any questions, be sure to let me know. Hopefully this wasn't too confusing. There was a lot of information to cover, and I tried to hit on all the basics. So again, if you have any questions, ask. I always enjoy comments, so be sure to comment or like if you enjoyed this, and subscribe for more.